Today's Americans are living longer lives. Improvements in medicine, public health, science, and technology are significantly changing the overall age composition of the elderly population. The Administration on Aging estimates there will be over 71 million older persons by the year 2030, more than twice their number in 2000. With this progressive rise of people living longer, an increasing segment of the elderly population will inevitably be afflicted with chronic conditions, and that is expected to place more strain on an already taxed healthcare industry.
A trend that we anticipate seeing is a sharp increase in the elderly population. This will create an issue for an already understaffed healthcare industry. This will particularly be an issue for those individuals who live in the community alone or who have chronic conditions as they require special monitoring and services.
Diabetes and high blood pressure are just a few of the common chronic illnesses facing our aging population. For the elderly who live alone or have no family to care for them, receiving services and support they need on a daily basis becomes a challenge.
I didn't have anyone professionally to tell me with accuracy exactly what should I do next.
The challenges I see on a regular basis are that the healthcare industry is being stretched to the limit. People are living longer. They're faced with many healthcare issues that need monitoring for them to be able to maintain the quality of life to which they're accustomed. They frequently hesitate to get these treatments because of the high cost of the healthcare.
One solution to the rising costs in healthcare and the shortage of trained nurses is home health nurses combined with telehealth technology. This alternative allows elderly individuals who can still live on their own the convenience of occasional visits from nurses, along with continued testing and monitoring of their health.
Home health care allows individuals who are in the community to receive their services in their own home. They receive visits from nurses, therapists, or home health aides on an intermittent basis. The use of telehealth monitoring allows us to take this one step further. The best part of the technology is that we can get daily information regarding the patient's vital signs so that we can make more appropriate decisions.
Many home health agencies are recognizing the potential of telehealth technology and realize that the healthcare experience for the patient can be significantly improved. Through daily testing and monitoring, a patient can receive the same clinical results as conventional care conveniently at home.
Because patients are monitored on a daily basis and the data can be readily available to the physicians, the physician will then be able to adjust the patient's treatment and decrease the incidences of emergency room visits and hospitalizations.
Instead now, since we have that device, which is professionally operated and monitored, I feel definitely more secure and I feel like I'm being taken care of.
The ever-increasing elderly population has challenges to face. Advances in home health care are helping aging Americans maintain their health, independence, and peace of mind.
We anticipate that telehealth and the use of telehealth in home care will continue to expand over the next few years. It's really just in its infancy. What we expect to be able to see is more tests, different types of monitoring, and more enhanced information on which healthcare practitioners can make decisions related to the individual. This will also enhance the person's quality of life and allow them to stay in the community longer.
Visiting Nurse Regional Healthcare System is an agency committed to providing experienced home health nurses, advanced technology, and compassionate care to the elderly community. This highly respected agency has the quality resources and staff to make a difference in the lives of many, and is recognized as a company with a heart, passion, and desire to bring outstanding health care to the elderly population.
Visiting Nurse Regional Healthcare System was established in 1888 as the first visiting nurse association in New York City. Our mission is to provide the highest quality of home health care services to individuals in the 5 boroughs of New York City and Westchester County.
To further enhance a patient's outcome, this agency has harnessed the power of technology to improve the healthcare experience.
We implemented telehealth in home care for 2 primary reasons. One was that it allows us to get better information about the patients we serve in the community. The other was to enable us to address the nursing shortage and provide better opportunities to utilize our nurses in more effective ways.
Home telehealth can be incorporated as a part of routine care. By providing early detection of symptoms and problems, patients may avoid costly emergency room visits and hospitalizations.
Some patients and their families feel that with the use of the telehealth monitoring, the human factor will be compromised. Actually, this is not true. We are able to spend more time with the patients. They're being monitored 7 days a week, 24 hours a day. There is a clinician that's available to analyze the data, and we are able to get in contact with the patients as needed.
Very accurate system. It's very interesting, and I feel secure, more secure. Whenever they see the readings, they immediately call me to tell me what to do.
As the aging population increases over the next 2 decades, it will become increasingly important to develop ways to manage chronic conditions. Through technology like home telehealth, the burden on our healthcare industry and the rising costs associated with treatments will be eased, and elderly patients will experience better self-management.
Visiting Nurse Regional Healthcare System has always been in the forefront of identifying new technologies which will enhance the quality of care that we provide to individuals in the community. Telehealth was just one of those initiatives. As we move forward, we expect to identify new and creative ways to provide better and higher quality care to individuals in their homes.
Visiting Nurse Regional recognizes that each patient is not just a number and a diagnosis, they are human beings. And by providing effective and compassionate in-home services, they are making a difference in the lives of the elderly population.